Hello everyone. I am Ethel Camille Gallardo, and together with me is my partner, Carlisle Shane Burgos. And today we will be presenting our location analysis for dental practice. So, this is an accomplishment for our practice management in dentistry. So, this video we will present three municipalities and city that is located in Cebu province, and these are Malboal, Cebu, Argao, Cebu, and Talisay City, Cebu. And this analysis will cover the age demographics, the income levels, population density, competition, accessibility, and growth potential of these three places. So first is Moalboal. So it is a coastal municipality in the island province of Cebu. So the municipality has a land area of 124.86 square kilometers, which constitutes 2.53% of Cebu's total area. Its population, as determined by the 2020 census, was 36,930, as seen in the graph. So this represented 1.11% of the total population of Cebu province, or 0.46% of the overall population of the Central Visayas region. Based on these figures, the population density is computed at 296 inhabitants per square kilometer. So the population by age group. So according to the 2015 census, the age group with the highest population in Moalboal is 5 to 9 with 3,581 individuals, and conversely, the age group with the lowest population is 75 to 79 with 470 individuals. Combining the age groups together, those aged 14 and below, consisting of the young dependent population, which includes babies, children, and young adolescents, makes up an aggregate of 32.91%, or 10,246. Those aged 15 up to 64, roughly the economically active population and actual or potential members of the workforce, constitutes a total of 59.46%, or 18,510. And lastly, the old dependent population, consisting of the senior citizens, those aged 65 and over, are a total of 7.63%, or 2,374 in all. So next. In Malboal, Cebu, the income levels generally reflects the broader trends seen in the Philippines. So most of the population in this region would likely fall into the low income but not poor or lower middle income categories. According to recent data, low income household typically earns between the poverty line and twice that amount, while lower middle income families earn between 2 to 4 times the poverty line. The economy in Malboal largely depends on tourism, with many people working in hospitality, diving shops, and other tourist services. For example, a typical tricycle fare that costs around 100 to 200 pesos, which provides some perspective on local cost and wages. So in Malboal, Cebu, there is only one dental clinic located, and the services offered is general dentistry, orthodontics, and cosmetics dentistry. So in Malboal, Cebu, there are several modes of transportations available for locals and tourists. And these are tricycles, the three-wheeled motorcycles, commonly used for short distances within Malboal and nearby areas, and they are convenient and widely available. There are also motorbikes, are also known as habal-habal. So these are motorbike taxis, or they are common to travel around Malboal, especially for those looking to reach more remote areas or beaches. There are also jeepneys, the traditional Filipino public transport that operates on certain routes, mainly connecting Malboal to nearby towns or to the city of Cebu. There are also buses and vans, or also known as V-Hire. So if you're traveling from Cebu City or other towns, you can take a bus from the South Bus Terminal in Cebu City. So private cars and rentals, you can also rent a car, van, or private vehicle, ideal for tourists who prefer to explore at their own pace. And there are also bicycles that are available for rent to some parts of Malboal, allowing for a slower paced scenic way to get around. So the growth potential for a dental clinic in Malboal, Cebu looks promising, especially considering the area's expanding tourism industry and growing local population. So here are the key factors that can drive this growth. So number one is the tourism-driven demand. So Malboal's influx of international tourists, many of whom seek affordable healthcare in the Philippines, present an opportunity to tap into dental tourism. We should have offering services like dental cleanings, cosmetic procedures, and emergency care for travelers that can increase demand. With many tourists engaging in adventure sports like diving and trekking, accidents may also lead to dental emergencies, and being a reliable provider of urgent care can fill a crucial gap. Number two, it's growing local population. As Malboal continues to grow with an increasing population due to its tourism and development projects, the need for consistent and quality dental services for residents will rise. General dentistry, pediatric care, and orthodontics are services that will be needed. Number three, the lack of dental providers. So, as we all know, there are only one. So, given this setting, we are all equipped, should have well-equipped clinic with modern technology that could give significant competitive edge. Next is collaborative partnerships. So they are partnering with local hotels, resorts, and tour operators that could help establish a dental clinic that caters to both tourists and locals. So offering packages deals for dental checkups or discounts for long-term visitors can create a steady flow of clients. Next is diversifying services. So offering a wide range of services such as preventive care, cosmetic dentistry, such as whitening or veneers, orthodontics, and even dental implants would appeal to a broader audience. Offering a high demand specialized services like oral surgery, endodontics, and cosmetics enhancements can differentiate the clinic. Next is community health initiatives. So holding community dental health campaigns or partnering with local schools for dental education programs can build a loyal local clientele. Collaborating with local businesses and government's programs that provides dental coverage to employees is another growth avenue. And lastly would be telemedicine and remote consultation. So what we mean by this is virtual consultations, like introducing remote consultation services for tourists or patients outside Moal Boal that can expand your reach and make dental care more accessible for emergencies or pre-treatment consultations. Given Moal Boal's ongoing development and increasing prominence as a tourist destination, there is a substantial potential for a dental clinic that caters to both locals and international visitors. Next place is Argao, Cebu. So its population is determined by the 2020 census was 78,187. So the municipality has a land area of 191.50 square kilometers, which constitutes 3.87% of Cebu's total area. So according to the 2015 census, the age group with the highest population in Argao is 5 to 9 with 7,399 individuals. Conversely, the age group with the lowest population is 80 and over with 939 individuals. Combining age groups together, those aged 14 and below, consisting of the young dependent population, makes up an aggregate of 29.66% or 21,466. Those aged 15 up to 64, roughly the economically active population and actual or potential members of the workforce, constitutes a total of 63%. And finally, the old dental dependent population consisting of the senior citizens, those aged 65 and over, are a total of 7.31%, which is 5,292 in all. So the income levels in Argao, Cebu generally falls under the low to lower middle income range, typically of rural areas in the Philippines. To give a clearer picture, the income levels of people in Argao, like many rural areas in the Philippines, can vary but are generally lower compared to urban centers. So number one, they are agriculture-based income. So many residents in Argao rely on agriculture, fishing, and small-scale farming as their primary source of income. There are also Argao also has growing tourism industry with some attractions like heritage sites, beaches, and ecotourism activities. And this has led to some growth in small businesses such as local restaurants, guest house, and tour operations, which provides additional income opportunities. There are also remittances, like many areas in the Philippines. Remittances from overseas Filipino workers are a significant part of household incomes for some families in Argao. And lastly, government employment. So there are local government jobs and teaching positions that also provide steady but modest incomes for the people in Argao. So overall, Argao's income levels are modest, with most people living on wages typically for rural areas in the Philippines, and wealth distribution is uneven, with some relying on remittances or small business ventures to supplemental agricultural earnings. So for Argao, Cebu, the competition analysis, so there are 6 dental clinics located in Argao, Cebu, and there are 6 general dentistry, 5 orthodontics, 1 oral surgery, and 3 for aesthetic dentistry. So Argao, Cebu, so their accessibility to places, so same for Moal Boal, there are tricycles, motorbikes or habal-habal, jeepneys, mainly connecting Argao to nearby towns of Cebu, buses and vans, private cars and rentals and bicycles. So the growth potential for a dental clinic in Argao, Cebu is promising due to several factors. So number one, it's increasing local population. So as Argao develops, the population is growing, and more residents means a higher demand for regular dental care and specialized services. Number two, limited dental services. So if there are few dental clinics in the area, a new clinic could attract many local patients by offering quality services and modern facilities. Number three, economic development. So with ongoing economic development, there may be more disposable income among residents for healthcare services, including dental care. Tourism growth. As tourism grows in Argao, there may be more opportunities to attract visitors who need dental services during their stay. Healthcare needs. So, raising awareness about dental health and availability of quality dental care can drive demand for regular checkups and preventive treatment. And lastly, community engagement. So, engaging in community health problems and educations can help build a loyal patient base and increase visibility. In summary, a dental clinic in Argao can thrive by addressing the needs of a growing population, leveraging limited competition, and capitalizing on both local and tourism-related opportunities.
So now we have Talisay City, Cebu. So the city is in a coastal component city in the island of Cebu. The city has a total area of 39.87 square kilometers, which constitute to 0.81% of Cebu's total area, and its population is determined by the 2020 consensus, which was 200,000, 263 and 48 people. And then population by age group. By the 2015 consensus, the age group with the highest population in Talisay is 15 to 19, with 24,438 individuals. Conversely, the age group with the lowest population is 80 and over. So, combining those age 14 and below consists of the young dependent population, which includes infants, babies, children, young adolescents, teenagers, make up the aggregate of 30.98%. While those age 15 to 64, roughly the economic active population, and the actual potential members of workforce constitute to 65.18%. Finally, the old dependent population consists of 65 and over years old. Total is 3.84%. So in terms of the income levels of residents in Talisay, Cebu, generally range from low to middle income, though they are varying levels based on occupation and economic activity. So we have low economic earners, such as laborers, farmers, residents works in agriculture, and then casual workers, which is jobs in construction, factory work, informal sector falls in this range. And then low middle income earners, we have small business owners, public sector employees, skilled workers. Then we have middle income earners, which are professionals and or who receives remittances. And then in Talisay City, Cebu, there are 20 dental clinics located. We have 20 general dentistry, practicing general dentistry, 20 orthodontics, oral surgery, 8, and then aesthetic dentistry, 13. So Talisay has a mix of urban and rural areas. So income levels vary. We have main transportation such as jeepneys, tricycles, buses, taxis, motorbikes, private vehicles, van for hire, and then bicycle. So the growth potential of Cebu, of Talisay City, is that its expanding population. Talisay City is experiencing a population growth as more people move to this area for its proximity to Cebu City. There is a rising in middle class. As middle class grows in Talisay, more residents can afford regular dental care, cosmetic dentistry, and specialized treatments. Then, as said earlier, proximity to Cebu City. Then limited competition. If there are relatively few dental clinics in Talisay, new clinics offer quality services and modern technology could quickly establish a strong patient base. Then healthcare awareness. With better access to health information, more people are becoming aware of the importance of dental care. Then corporate and family plans. Partnering with local companies for dental plans for employees can create a steady flow of clients. And then tourism. The rise of tourism and expat communities in this area can create opportunities for specialized services, such as implants or cosmetic dentistry, and they are demanded by foreigners. And then convenient location. In terms of accessibility, Talisay is well connected in transportation options, making it convenient for patients. So by targeting both locals and commuters, offering affordable, high-quality care, a dental clinic in Talisay City has significant growth potential. So in comparison, the three cities, which is Talisay, Argao, and Malboal, in terms of age, predominantly all are in working age. And then in terms of income level, both Argao and Malboal are predominantly low income population. Compared to Talisay, they have middle and lower class population. Then in terms of population density, Talisay have high population density, and then Argao as moderate, Malboal as low. And then in terms of competition, with 20 dental clinics, we have Talisay as high. With 6 dental clinics, Argao is moderate. With only 1 dental clinic, we have low, Malboal. Then in terms of accessibility, Talisay is excellent, located near Cebu City, highest transportation availability. And then in Argao, we have a lesser transportation option because it is 72 kilometers away from Cebu. And then in Malboal, we have 90 kilometers away from Cebu, so it has the least transportation option. And then in terms of growth potential, Talisay is high, again due to proximity to Cebu City and rapid urbanization. Then Argao is moderate due to growing population and improving accessibility. They are same, moderate set of Argao and Malboal. Then overall, the suitable location for dental practice in Cebu province, we have analyzed that it is Talisay City. Yay! And then in rationale is that balance of population and density and growth. Talisay has the high population density, thus making it a prime location for steady local clientele as well as potential patients for nearby urban areas. We have moderate competition with only 20 clinics. The competition is present but not overwhelming, and there is room for differentiating our services or target specific market segments. And then in terms of accessibility, we have multiple transport options. And then middle class growth, the presence of growing middle class population suggests the potential for dental services catering to higher end and expanding beyond treatments. Talisay combines growth, potential, accessibility, manageable competition, making the most suitable location for future dental practice or current dental practice compared to other options, Argao and Malboal. So in creating our dental clinic, we have action plans. We have to differentiate our practice. We have to focus on specializing in higher end dental services to attract middle and upper class clients. Then we can also have a partnership or collaborate with school, community health initiative, and local businesses to build a client base. And then long-term growth. As urbanization progress, we can anticipate expanding services or scaling to multiple locations in the region. So that's all for our location analysis. Thank you, Doc.